Hi, I'm Emiliano Ghinelli and I'm an ophthalmologist, and O.S.I.R.I.S represents my latest work in the field of mechanical engineering, electronics and ophthalmology. The human eye can be affected by a various number of diseases, as cataract, corneal diseases, refractive errors complication, glaucoma, retina detachment and diabetic retinopathy. Such diseases and defects are mostly solved by surgery. It's estimated, in fact, that last year 3.6 million cataract procedures were performed only in the United States. The surgeons usually work in a few micron space, where delicacy and difficulty require great precision. Many, in fact, are the pitfalls that comes into play, from the resistance of the tissue to their thickness, from the amount of anesthetic administered to the height and depth of the scalpel entrance, until the pressure exerted towards the tissue. Variables that, if they were known, could help the surgeon, but that the current equipment are not able to provide them. To date, none of the sophisticated equipment in the market provides these informations. I believe it's time then to make a change and fill this gap. That's why today I will introduce an innovative system developed starting from the needs of the surgeons and able to link together different microsurgical and diagnostic instruments in order to maximize the accuracy of the operation and to reduce the human errors. And its name is O.S.I.R.I.S. Since 1996, I've been developing and conducting research experiments in different parts of the world, as the United States, the United Kingdom, and also in Italy, where at the National Research Council I've developed several patents which are now being approved by the Ministry of Health as a transplant. My personal experience as a chief of ophthalmology is now based in Volta Mantovana, near Mantova, and as a scientific director in Brescia at the Institute of Micro-Ocular Surgery. What is O.S.I.R.I.S then? O.S.I.R.I.S is an integrated robotic system developed following surgical needs. This allows the surgeon to perform surgery with the maximum safety and precision as possible, even remotely. And O.S.I.R.I.S can do that because it's linking together the most recent surgical devices and the most innovative diagnostic devices, which are going to be listed as follows. Such as the femtolaser, the phaco, the OCT, the microscope, a thermocamera, the echography, and a pressoceptors, with the aim of maximizing the precision of intervention and reduce human errors. It can be integrated with other surgical systems because it can communicate with other technologies. O.S.I.R.I.S is a device that can change the way of thinking about the surgery. As the Egyptian god drove the souls in the afterlife, so O.S.I.R.I.S can guide the surgeon through the intervention. But how? Basically, due to the fact that has been developed taking into account 9 fundamental parameters, ignored by the major equipment developed until now. In this example, you can see the surgeon face a screen that is at the same time recorded by 2 video cameras that can simulate the movements of the surgeons and transmit these movements to the robotic arm or the exoskeleton of O.S.I.R.I.S. Tissue hysteresis, tissue transparency, pressure applied on tissue, the difference between the movements and the heating of the tissue, and also the redirecting by on video instructions the hands of the surgeons, and the modification and adjusting the images by the acquired by PC optical image and the position of the hand of the surgeon, along with the energy delivery and the energy absorption by the tissue, and the heartbeat movements are compensated. We can see it as a fusion between the robotic and the mind of the surgeon that ensure a more accurate, safe, less invasive and painless procedure, as well as a minimum recovery time and a post-intervention complications. In this other slide, there is the particular of the robotic arm that gets into a particular place on the limbus and then through the cornea into the eye, ensuring movements into the three axes. So let's summarize the capability of O.S.I.R.I.S and its features. First of all, O.S.I.R.I.S doesn't need an operating room to work. Secondly, thanks to its integration and linking with other systems, it's capable of working remotely. Third, can train young ophthalmologists while it's guiding also experts and well-trained ophthalmologists during the surgery. Fourth, thanks to its integration between surgical instruments and diagnostic instruments, O.S.I.R.I.S can prepare the tissue for surgery, meaning can prepare donor tissue into a tissue bank. Fifth, and very important, can avoid surgical errors. Along with my personal thanking for your attention, I would like to thank also my family, wife and kids for the patience that they used me during all these years of development of O.S.I.R.I.S. And also this moment is very important to advise you regarding O.S.I.R.I.S per se. O.S.I.R.I.S is not a closed project. It requires financial support every year, every day, every moment of development. So you are more than welcome to help. Thank you very much.